So this is Dr. Wooler for Autism Recovery 101. Thank all of you for attending and welcome to the course. There's going to be a lot of information we're going to go over the next 6 modules with regards to this course. And the primary focus of this specific course is really geared towards, the new parent to this biomedical approach, this integrative medicine approach, if you will, to autism. Or perhaps you might be a parent who's maybe done some things in the past, maybe tried a gluten casein-free diet or tried a few supplements, but never really got too deep into this whole thing. And so just trying to maybe reorient yourself, maybe get more of a solid foundation on what this whole medical approach is to autism. And so this course is really designed specifically for you. There's going to be a lot of things that I'll talk about, even beyond what's just on the slides. So I'll expand on concepts. I'll throw in things from my practice that I've seen over the years. So this is also that type of course where you're going to want to come back and listen to these presentations as well, and you'll have ample time to do that. So it may be something that you want to come back and listen just maybe to a segment of a particular lecture, or maybe you want to listen to the whole thing again. So I encourage not only individual parents, but mom, dad, and other people who are involved in your child's health to also take a part in these particular presentations, so that they have a good understanding of what's going on. So this particular module, this particular lecture I'm going to do what's called a brief overview of what I call the 4-pillar approach, or this system that I've worked off for many years, and really try to emphasize why I feel it's so important, why it's so critical from a teaching standpoint, but also understanding how critical it is with regards to biomedical approach, because really if you skip the 4 pillars and try to pass over it and go into more deeper therapies, oftentimes you don't get good success because you don't have a good solid foundation. And then interwoven through this lecture, and be honest with you, as we go through the other modules and the lectures in those modules, I'll be talking about other kinds of medical problems that come up, but we're going to touch on some of the common medical problems, biomedical, biological problems, whatever you want to phrase them, that I really feel you need to know about. So as a parent just stepping into this field, or perhaps as a parent maybe you've been working in this area peripherally for a while, these are key concepts that I think will really help you understand where you're going with your child when you either try and learn some of this information on your own or work with a practitioner who is doing biomedical intervention, and as well as information that you can share with others of people who are involved in your child's life. There are a number of different documents in the different modules throughout this course. Now for Module 1, which is where we're in now, there are a few documents that you have access to. These are all in PDF format. So we have something called Getting Your Child to Take Supplements as a PDF, and then Suggestions for Implementing a Gluten and Casein-Free Diet. So if you go into the module section for Module 1, those are printouts or things that you can download to your desktop, print them out, put them in a folder, use them in any way that you need to for your personal use. We also have the lecture slides, and then we have a version called the lecture slides note-taking. So the note-taking is nice. Basically what you can do is you can download that form and print it out. And so as you go through the lecture for each module, you can take notes next to each slide. So you'll actually have a full PDF of each color slide in its expanded version, and then of course a note-taking. And the note-taking are mini slides. There's 3 slides per page. Also, in addition to this course, we have the forum where you can post questions on a daily basis. So there's a number of different categories as part of that forum. And then we have built in a couple separate question and answer sessions. The question and answers sessions will come after 3 modules. So we'll end up having a question and answer session a couple weeks. And that's an opportunity for you to come on, ask questions, share information, and then I also take that opportunity during the questions and answers to expand on other types of topics as well. Also within each module, there will be videos. And the videos are meant to support the documents and meant to support the presentation for that particular module. So the videos for this particular module will be loaded later in the week. So let's get into the key aspects of this. And this whole approach of biomedical intervention for autism has been around for many, many years. I first became involved in this field back in 1997-98 when I first attended a Defeat Autism Now conference in San Diego. And as time has gone on, the amount of material has expanded, the amount of interventions available has increased significantly, and our overall knowledge base on what to do has also increased. For myself personally, what I've noticed is my own ability to really be able to work with families not only locally but throughout the US and internationally, and really be able to hone in pretty specifically on some of the key concepts that I think are areas that need to be addressed. And the reality is every child is different, but there are certain therapies and certain things that tend to work consistently well. And the first pillar of this 4-pillar approach, and the 4 pillars are diet, supplements, digestive system intervention, and methylation. Diet is number 1. It's the top of the list. You're not going to get very far with most kids if you skip diet. Now, the thing about diet is it's a huge topic because there's not always just one diet. We know we have the gluten casein-free diet, the GAPS diet, the specific carbohydrate diet, and I'm going to talk about these things throughout the different modules of this course. But diet is very, very key because even as Dr. Bernard Rimland discovered and discussed many years ago, who was the founder of Autism Research Institute in San Diego, the vast majority of kids, around the world who at least minimally are put on a gluten and casein-free diet do extremely well, and the statistics are quite large. We're talking upwards of, in my experience, 75–80% get positive response. We'll talk about that shortly. Foundational supplements are key, and the reality is a lot of kids are nutrient deprived because of their self-selecting to certain foods. Plus, also the gastrointestinal issues tend to prevent some of the nutrients from getting absorbed. We do have foundational supplements, and then there are more targeted supplements for specific issues, and of course that will also be woven into this course as well. So in Module 2, I'm going to go a little bit more specific into supplements, particularly tips and suggestions about how to dose supplements, implement supplements, because it's not always an easy task. But the one key concept of supplements is you have to treat them as medication, meaning you have to be diligent in your approach. Just like if your child was prescribed an antibiotic for a respiratory infection, you're going to make sure they get every dose. You need to take that same tenacity with supplements. It's the consistency over time that makes the biggest difference. The third pillar is digestive system intervention and assessment. This is a big topic. We actually have in Module 3 of this course where we're going to go through how to interpret an organic acids test from Great Plains Laboratory. That is a key test. You need to know how to use it, when to run it, and what some of the markers can mean, and more importantly, what some of the markers can mean in relationship to certain behaviors that your child may have. We always want to assess for Candida and Clostridia problems because they are highly represented in the special needs community, and the kids with special needs just seem to be more sensitive neurologically to the toxins of Candida and yeast. But not everything in autism biomedically is a yeast problem. So, but we have to understand where that fits. The fourth pillar is methylation. And this is a big, big topic. It's a complicated topic. There's a lot of biochemistry that can be involved. And so my emphasis for this course here is to really strip down all of that, the nitty-gritty biochemistry that can just be confusing and clutter the issue, and really hone in on what's most important. The reality is that methylation is a key biochemical process for all of us. It's often dysfunctional in autism because of either certain genetic factors or what are called epigenetic factors. This is outside factors, environmental influences, for example, that can affect the way the enzymes in these systems work. The bottom line is we have to, at some point, at some level, implement some type of methylation intervention, because it is the catalyst in many regards to further advancing a child as far as their cognitive abilities go. But if you just jump right in and try and do methylation from day one, or methylation support from day one, sometimes you'll get a positive response, but at other times it's hit or miss because you haven't done the other foundational work. There might be dietary factors, supplement deficiencies, or digestive system problems getting in the way. Okay, so we're going to go through we're going to spend some more time on some slides and move through other slides more quickly. Now, I don't really need to explain to you as parents what is autism, okay? And we know that if we just look at it purely from a diagnostic criteria, it's broken down into social categories, communication problems, and repetitive and stereotypical behavior. That's sort of the cut and dry approach to autism. And of course, the conventional medical system will just try to treat some of these specific things either with medication or sometimes appropriately behavioral therapy and speech therapy, etc. Not that those other therapies can't be helpful, and they often are. But what we often find from a medical standpoint, and really from a clinical standpoint that I see in practice, is kids often being mistreated is kind of a strong term, but the failure to treat of the medical community, because I believe that many medical professionals are prejudiced by this autism diagnosis. So you can have a child who can have physical milestone problems, chronic bowel problems, skin issues, respiratory infections, and they also maybe have some attention problems, anxiety. But because they don't have the label of autism, the doctor or pediatrician will do some lab testing to figure out what may be going on. Maybe there's an infection or allergies of some sort. But oftentimes, if that same child comes in with the same symptoms, they're often ignored. And I've seen this over and over and over by the medical community, where the doctor doesn't look at this child having medical problems. They just assume that the chronic diarrhea and the respiratory issues or the skin problems are all just related to their autism diagnosis. But nowhere on the diagnostic criteria list is chronic diarrhea, eczema, or skin problems a thing that comes up as part of their diagnosis. So my whole approach has been kids with autism, whatever label they're given, often have underlying medical problems that need to be addressed. And for you as a parent, you need to understand that in part some of their condition and behaviors can be linked to some of these underlying problems we're going to talk about. Now, the Centers for Disease Control here in the United States has strongly emphasized that in the autism population, more so than sort of the neurotypical, neurotypical community, that autistic kids tend to have a higher rate of ear and respiratory infections, sleep disorders, asthma, allergy problems, headaches and migraines, and seizures. Now, seizures occur about 35–40% within the autism population, and actually I think it is often higher. a lot of kids tend to have underlying seizure activity that might be affecting behavior, certainly could be affecting school performances, but it's not so profound that it's these obvious outward manifestations that are occurring. So if you get to a point in this biomedical approach with your child where you're doing diet, you're doing supplements, and you've worked on the many things that we're talking about, and they're still having behavioral problems, and they're still just not improving, at some point I think it is worthwhile to have them assessed for an underlying seizure disorder. Clearly, if there is significant cognitive decline at certain times, or there's severe behavioral problems that may occur, that should even be more of an emphasis to rule out seizure activity because it tends to occur so highly. The other thing that occurs very significantly in this population is gastrointestinal problems. It is a huge deal. In fact, the GI system can play such a role in behavioral problems that I feel like if it's not addressed or not assessed, then you can do all the behavioral therapy you want, you can do all the speech therapy and occupational therapy, you're going to have, kids who just aren't improving because they either have a lot of toxins in the gut or they have pain coming from the digestive system that can affect their behaviors as well. And so autism and the biomedical approach really understands that autism is more than just a brain disorder. It is a multi-system disorder that affects the brain. And that the underlying core problem for many kids, and certainly I've had autistic individuals in my practice that, there's a strong genetic link to it, but they can all be helped. And that often what we're doing is we're looking at things medically. And so you as parents are looking at things medically as well. You're trying to address the underlying health of your child to try to improve their overall function and autistic condition. And there are a lot of medical complexities. We'll talk later in this course about some of the methylation problems. Nutritional imbalances are significant. That's part of our whole second pillar approach. Mineral deficiencies, sometimes vitamin deficiencies because of cell-selected diet, cholesterol deficiency, which often isn't recognized by the conventional medical community, but is often a big problem in autism. Matter of fact, most of the kids that I've tested have had low cholesterol levels. And low cholesterol can be a problem because cholesterol is necessary for proper hormone production in the body. It's also very important for the formation of something called bile to help us absorb nutrients from the digestive tract, particularly the fat-soluble vitamins. And cholesterol is also important in the brain to help with normal function of brain cells. So if there is a cholesterol deficiency, it's something that needs to be or should be addressed. And there's some ways to do that, which I'll discuss later. Food sensitivities are significant. And so if you're new to this, the first place to really start is really looking at the removal of gluten and casein. Those two things tend to be major problems for the vast majority of kids on the spectrum. And statistically, more kids have a dairy sensitivity than they have a gluten sensitivity. I'm going to talk about the differences between the two here shortly. We already mentioned digestive problems, constipation, diarrhea. Some kids have inflammatory bowel disease. And more than not tend to be constipated. And the constipation can be a trigger for behavioral issues. And I have a case towards the end of this presentation. I'll talk about that. One of the reasons that we recommend running certain tests is to rule out infections. So just like trying to do more advanced therapies, in the presence of infections, you're not going to get very far. And what I mean by advanced therapies would be things like, heavy metal or immune system treatments, heavy metal detox, hyperbaric oxygen therapy, etc. We don't want to get to those points until we can really focus again on the foundations. Clostridia bacteria and yeast can certainly affect behavior. Some kids have heavy metal toxicity, but not all. But it is an area that we want to look at and understand that it may be something that is causing stress on your particular child. And then, of course, some of the other deeper issues of brain inflammation and neurochemical imbalances that can come about. But the point is this, is if you've got a child with digestive issues and they have food sensitivity, those two things alone will cause many of the inflammatory problems as well as cause many of the neurochemical problems that can affect attention, focusing, behavior, sleep, and even speech. Because the brain regions in autism have been pretty well mapped out, whether it's looking at the frontal lobes that are involved in planning functions or the temporal lobes, which are involved in auditory processing, the hippocampus, or this area called the amygdala, which is involved in memory and emotional control. If these areas, which are already vulnerable, are affected by inflammation or are being affected by some of the chemical toxins that come from within the body, particularly the gut, then you're going to have a child that starts to manifest with auditory and speech problems, or planning function problems, emotional problems, etc. So let's focus on the first pillar, and this is dietary intervention. And again, this is not going to be the first time you hear about diet. We're going to talk about diet throughout the course. But a place that you can start as a new parent is start with diet. You've got to start with diet, just improving the quality of your child's diet. It plays a major role in autism intervention, and it's something that you control. The reality is without a healthy diet and really the removal of these toxic foods, you're just not going to get very far. Okay? It doesn't matter how many supplements you give, how much other type of therapy you do. If you've got a child that's got a lot of food sensitivity problems, this has to be dealt with. And there's a difference between how the medical system looks at food reactions. Our body can react to foods in many different ways. The most common way is that we have an adverse immune reaction. And the most common immune reaction, or I should say the more obvious immune reaction to a food, is something called IgE. This is the allergic response. This is where you get immediate symptoms, itchy eyes, hives, runny nose, cough. Okay, this is that histamine response. But more commonly is that people have more of this delayed reaction to food, something mediated through what's called IgG. And this is a delayed response. This is something that is seen more from a chronic illness or psychiatric problem. It causes low-level inflammation. It might affect mood, but it's not till later. You might get digestive problems, some loose stool or gas because of it. But it weakens the immune system too. It's easy to test for IgG reactions. Most people who have food sensitivity, it's because of an IgG response, an immune response, versus an IgE response. Now, I do a lot of testing through Great Plains Laboratory, and Great Plains Laboratory is a lab that is very specialized in providing labs for kids with special needs. And this particular profile, called the Comprehensive Food IgG test, is what's called a dry blood spot. It means it's a finger prick test. It can now be done at home. So you can collect this sample at home without having to have a blood drawn for the food reactions. More times than not, dairy is high, and then from time to time you'll see gluten high. Statistically in my practice, I've seen about 70% of the kids are more dairy reactive than they are gluten reactive. This is a fairly common profile. High casein, fairly high gluten response. So this is a child that actually has a dairy sensitivity and a gluten sensitivity. The other component of food reactions that you need to understand is, again, it's not all just an immune response. Gluten and casein also, because of their chemical structure, have a similarity to to opiates. Okay, and opiates basically have a chemical similarity to morphine. So The casomorphine and the glutamorphine are these opiate-type structures that occur within those two food proteins linked to gluten and dairy. And what these things have is they have more of a drug-like response. They can affect attention, and they can affect focusing, and they can affect behavior. They can affect sleep. And many times the response is very quick. It's a very quick onset after consumption of one of these foods, whereas the IgG reaction tends to be more delayed. This reaction is more immediate. So this is something where a child would be, you would notice they've got language problems or eye contact problems, behavioral problems that come about sometimes within 30 minutes after eating either gluten or casein. The urinary peptide test that Great Plains carries helps to analyze for this. Notice in this particular case, we've got a casomorphine marker greater than 500. And that's very high. Matter of fact, the test maxes out at 500. So in this particular case, we know we have a child that has a casomorphine, okay, a casein milk drug-like sensitivity to milk. This is where they're going to have the immediate reactions in most cases behaviorally to milk and gluten. What happens is that these opiates that are coming from casein and gluten interact with different receptors in the brain. These things are called mu-opioid receptors. And they have, if we think about opiates from a drug-like response, they have an analgesic effect. They help to control pain. But one of the side effects of opiate medications is constipation. So it turns out that the opiates of gluten and of casein can cause constipation. And they can also blunt pain. So many of the kids who have a really strong sensitivity to gluten and casein peptides, think of peptides and opiates together, can often have a blunted pain response. Often will have constipation. And they'll have a lot of the behavioral problems that go along with it. It's almost like their nervous system gets numbed out or doled out because of the presence of these chemicals. And it's been shown that when kids are taken off of these foods, oftentimes there's great improvement, in that when the levels are quite high, in this particular case looking at casomorphine, the levels can be very high, which rates very high with the severity of scale of autism. This is measuring casomorphine in the urine and the severity of their autism. So what are some things that you can expect or hope to see, I should really emphasize, in taking out gluten and casein? Well, better bowel function, improved skin tone, maybe improvements in language and eye contact, certainly an increased appetite for other foods. That's commonly seen. Pain tolerance can be increased, decreased self-injurious behavior. I can't say that there is one symptom in autism that is fixed 100% of the time with any one of these therapies. But the gluten casein-free diet, just the pure form of the gluten casein-free diet, helps a good 75 to 80% of the kids who try it. And the initial trial, I feel, should be done minimally for 3 months. Ideally for 6 months, but minimally for 3 months. And the reality is this: you should see some type of positive response with your child. Gluten casein-free diet, adding in supplements, there should be something you can hang your hat on that tells you some things are improving. And it should happen ideally within the first couple months. You don't have to do these therapies for 6 months or to 9 months hoping to see something before they start working. It should be relatively obvious if it's going to help. What I recommend for people who are starting the gluten casein-free diet is to start removing the casein, the dairy component first, at least for the first 2 or 3 weeks. And the reason is, again, statistically, most of the kids have a higher casein sensitivity than they do a gluten sensitivity. Also, too, it's generally easier to recognize dairy foods that might be hidden in other foods than it is gluten. And then you can start eliminating the gluten. Now, in the module section for this particular lecture, there is a handout on suggestions for starting a gluten casein-free diet, and it goes through different steps on how to do that. What about combining these tests? So sometimes the testing can be a little confusing, right? So in this particular case, you'll notice, and this is casein, by the way, this is a child out of China, but the peptide came back very high for casein. I mean, look at it, it's over 500, it maxed out the test. So this is a child that has an extreme sensitivity to the opiate of casein, or that peptide of casein, having that drug-like effect, but they don't have an immune sensitivity to it. So more than likely than not, this is a situation where you're seeing a pure behavioral problem, cognitive problem, but you're not having any digestive problems, digestive inflammation that's occurring because of the dairy. And in this particular case, going off of the dairy, many times you'll see sometimes dramatic improvement within even the first week. Here's another scenario. Okay, we've got really high levels of casein on the food sensitivity test. So we not only have a food sensitivity immune reaction that could cause digestive system problems, bloating, gas, maybe sometimes even eczema in some kids. And we also have the, an elevated level of casomorphin, not like the last test that was over 500. But notice that our gluten immune reaction is minimal. So this child is not technically gluten immune sensitive, but they're carrying a high reaction to the peptide or that opiate of gluten. So again, it's a chemical intolerance versus an immune intolerance. In this particular case, there should be pretty quick results happening with the removal of dairy, and then add additional results that we'd be seeing with removal of gluten. In this particular case, just because the gluten reaction on the immune test was normal, this is a child that still should go on a gluten casein-free diet because they have the elevated peptides too. Again, minimally 3 months, and you should see something happening. Ideally 6, but minimally 3. There's a lot of support material on the internet, and this is an excellent book, okay? Really a book that's very specific for the gluten and casein-free diet. Has a lot of menus, other tips and suggestions on different aspects with regards to dietary intervention, but a great place to start to learn how to implement the gluten casein-free diet. Well, we also know that sometimes these food reactions can affect beyond just the gut, or that the peptides of these things can affect beyond just behaviors. And what this test was showing, or this study was showing, is that in some kids, the food reactions can have a profound effect on altering brain function with regards to inflammation. Anytime the immune system gets involved, gets engaged, and it starts to interact with the brain, it's going to cause some low-level inflammation. And remember, the inflammation can cause imbalances in a lot of those areas we talked about, the speech, the emotional, the behavioral aspects of the brain. And we have these things in the brain, these immune cells in the brain that become activated. And chronic activation of these immune cells causes further inflammation. So there's a lot of fancy types of interventions to try to curb brain inflammation, but the first place you can start, and really should start as a parent, just starting this approach, is diet. Get right with the diet, and you're going to already do a lot in helping to decrease some of the potential for inflammation in the body. We're going to come back and talk about the gut and brain connection shortly, but let's first move on to the second pillar, and that is nutritional supplements. We talked about supplement support's essential, and we're going to go through different supplements as we move throughout this course. I'm going to just focus on a few things right away, and that is what's called a starter pack. Okay. Whenever I consult with somebody, I want that child to be able to start some basic supplements. And a lot of it has to do with filling in the gaps nutritionally. Okay, because I know that many kids, again, are self-selective or have some feeding issues. And so we want to just get in some good nutrition to help complement the diet. A good multivitamin, mineral, some calcium, magnesium, and cod liver oil if possible. These would be minimal places to start. Now, calcium is critically important. You don't want to forget it, because when kids are taken off of taken off of dairy, they're primarily removing the main source of calcium that they're getting. And a lack of calcium can affect behaviors, and there have been cases of kids having eye discomfort where they rub their eyes very hard or they gouge at their eyes. So calcium is critically important for the autistic individual, at least in most cases. Cod liver oil is an essential fatty acid, and that's been shown to help brain function. Cod liver oil specifically has natural vitamin A in it. And vitamin A has been shown to be very helpful for the visual processing in the eyes. And what's been shown is that some kids have a decrease or a complete elimination of visual stimming and side glancing when put on cod liver oil. And we already know there's ample evidence to support that many of the kids are deficient in certain nutrients. My personal preference with regards to a starter packet is this particular starter packet from New Beginnings Nutritionals. New Beginnings is a supplement company you need to become familiar with. They're very supportive to the autistic community. They have parents who have special needs kids who have successfully treated their kids with biomedicine, and they're really there to help support you in learning how to use these particular products. Now, the nice thing about this particular starter packet is this Spectrum Mate product either comes in capsules or powder. And what's real convenient too is off their website, they give dosage recommendations for each of these things. So it's just something that is generally, I don't want to say it's easy to do, but generally easier to do when these things come prepackaged. So the Spectrum Mate is our vitamin, mineral, antioxidant, helps support the nutritionally and a healthy diet. Our cod liver oil, that is an essential fatty acid with natural vitamin A, and then calcium and magnesium to help replace the calcium that's being eliminated when you take the child off of the diet. Off of. This is just a capsule version. Some kids prefer the capsules. By the way, the capsules and the powder are the same. You could open the capsules up and mix it in, food or drink, but no reason to do that if you can just get the powder. So this is a good entry place and a place that I often start and recommend, even while we're waiting for tests to come back. Because again, you're just giving good nutrition here that oftentimes will spark an increase in cognitive awareness, or sometimes language or eye contact. The third pillar is digestive system assessment and understanding that there are different toxins that can come from the gut. One of the things that we're going to discuss in detail when we go through Module 4 and 5 of the course is the issues related to yeast. Now, this is just a complicated biochemistry slide, but the end result I want you to just point out is that yeast, and candida specifically, lives on sugar. Okay, so it uptakes sugar in the form of glucose, and it goes through this long sequence of reactions. And the byproduct that comes out after it's metabolized sugar is ethanol, ethanol being alcohol. This is one of the reasons that many parents have seen that their kids act drunk when they have elevated yeast in the body. It's a clinical observation, but it plays out more times than not. And so kids on the spectrum tend to be very sensitive to yeast. But not everything in biomedical autism is a yeast problem. So we'll go more into that later in the course, trying to determine how much of an emphasis do you give to treating yeast when the test comes back, but does it really pan out for your child clinically, symptom-wise, and how they're responding. Clostridia bacteria, same thing. Now, one of the reasons that I've emphasized for years that parents learn how to do the organic acids test from Great Plains Laboratory is that you want to know before you start treating yeast whether there's a Clostridia bacteria problem. There's many different types of Clostridia bacteria, but not all of them are pathogens. In fact, there's over 100 species of Clostridia that can inhabit the intestinal tract. That doesn't mean there's 100 in everybody. The vast majority of them are normal. They're what's called commensal bacteria. They don't cause any harm. And then there's some that are really problematic. We've heard about tetanus. I've heard about botulinum. Clostridium difficile gets a lot of press these days. And it turns out that some kids with autism have Clostridium difficile. And what's interesting is that usually the Clostridia difficile type that they have isn't causing massive digestive system inflammation. It's causing the production of certain toxins that can be measured on the organic acids test. There's two specific markers on the organic acid test that are very, very specific for the presence of Clostridia bacteria. This one here called HPHPA and the other one here called 4-creosol. So if you've done an organic acid test in the past, go back and look at it and see if one of those is high. 4-creosol is actually very specific to C. difficile. It turns out that HPHPA, one of the Clostridia bacteria that can produce it, is Clostridia botulinum, the one that causes, botulism. And so it's possible that some of the kids who show up with HPHPA may be harboring a very low level of botulinum Clostridia in the digestive system that can be affecting behaviors, that may be affecting muscle strength and coordination and speech. Here's the point. If you do an organic acid test and you find that one of these Clostridium markers is high, and you also find that the yeast is high, in my experience, you have to address the Clostridia. It needs to become a priority. At least it is in my practice. For me, it's a priority because it is a major roadblock and will get in the way of so many other things. And we're going to talk about that later in the course with regards to intervention for these things that you can even work with your doctor on. But there are also some things that you can do that I've learned about in just using supplements that can be helpful too. So you're going to have access to learn about how to implement and learn some of the important features of the organic acids test from Great Plains Laboratory. That'll be coming up in Module 3. Let's come back now and revisit this gut-brain connection. Why is it so important, and why is it occurring? Not every child on the autism spectrum has inflammatory bowel disease, okay? But if you have a child that started developing bowel problems, let's say after a series of vaccines, the MMR vaccine, for example, and they started developing chronic bowel problems, it's quite possible that they may have low-level bowel inflammation having been triggered because of that immune response. The main seat of immunity in our digestive system occurs in the small intestine. That small intestine is the intestine between the stomach and the large intestine. And this is the primary part of our intestine that is involved in nutrient absorption. But it's also, because of the high immune activity, vulnerable to problems of inflammation. And small intestinal inflammation can lead to behavior problems. Okay? It certainly can lead to gut problems of diarrhea or constipation, but sometimes it can also lead to behavioral problems too. Self-injurious behavior, food avoidance, poor absorption, poor growth could all be indications of small bowel problems. The large bowel is also involved. Okay? The large bowel, the large intestine, is where the bulk of our normal bacteria reside in our digestive system. Most of the normal bacteria that we have in our gut is not in our small intestine. It's actually in our large intestine. And the large bowel is there to, as the stool bile moves through the small intestine, moves into the large intestine, the large bowel is where we're starting to reabsorb a lot of the fluid, a lot of the water, so that we don't lose the hydration effect from our body. And it's a place where a lot of the toxins become accumulated to eventually be removed from the body in our fecal matter. But if there is constipation or there's inflammation in the large bowel, those toxins which are coming from the small intestine and dumping into the large intestine can be reabsorbed. And they can be reabsorbed and then lead to problems in the liver and also problems systemically, where they can affect brain function and contribute to behavioral issues. This is why it's so important that we have, at least as much as possible, a proper functioning digestive system so that we're removing these toxins from the body. These are examples here of extreme cases of bowel inflammation. Okay, and I wouldn't say this is very common. These are extreme cases. The one on the left is a situation where a child is actually refluxing bile, okay, coming from the small intestine and refluxing it, meaning that it's flushing backwards into the stomach. The one on the right is actually a situation where there is such severe motility issues in the digestive system that the child is refluxing bile, okay, or fecal matter essentially, back into the stomach. Severe situations. And this is why it's so imperative to understand that the behavioral issues that you see, the self-interest behavior, the aggressive behavior, etc., could definitely be coming from digestive system problems. And that it's not just part of the autistic condition. It needs to be looked at medically and often isn't. So we know that the digestive issues are a major problem. Now, think about gastritis. If there's inflammation in the stomach, you're going to generally have a child that is going to have food avoidance. They're not going to want to eat because it's painful when they do eat. Or if they develop, let's say, a behavioral problem of aggression or irritability shortly after eating, that could be an indication of gastritis. Usually smaller kids have the gastrointestinal reflux problem. That's something that you'll commonly see in newborns during that first year. But in some cases, I've seen reflux happening with older kids. It's not, and some of these things are not always easy to determine because you're having to try to figure some of these things out behaviorally. But again, reflux would be kind of similar to gastritis as far as the behavior goes. Inflammation of the colon or colitis, that generally is going to have to be looked at or identified, through an intestinal scoping procedure. But this would tend to show up with, erratic stools, maybe constipation, loose stools going back and forth. A lot of intestinal bloating could certainly be correlated to that as well. Constipation problems, motility-based disorders, okay, and then the food sensitivity problems as well. So if you have a child that is avoiding food or is certainly getting a lot of behavioral problems after eating, it really is important to think about the fact that they may have a deeper problem going on in the digestive system from chronic inflammation. And their studies really prove this out. This was a paper that came out in 2006 talking about how prevalent are gastrointestinal issues in autism. Well, they're quite prevalent. In fact, they looked at 150 kids. They had 50 children in each group. And they had kids that were non-autistic, essentially developmentally normal, other kids who were autistic, and then they had other kids who had developmental disorders that were non-autism related. And what they found was that 28% of the children with typical development had some type of GI problem: constipation, loose stool, bloating, gas, etc. But 70% of the children with autism had GI issues compared to 42% of the kids who had some type of developmental disorder that was not autistic. 70%. And that really pans out at what I've seen in my clinical practice too. I know this is a gross picture, but if you're a parent who has a child who has chronic bowel problems, this is something you need to recognize. Okay? Does this look like your child's stool? This is not normal. We all can have loose stool from time to time depending on what we eat. But if this is a chronic situation, this is pathologic. Okay? So more times than not, this is chronic inflammation in the small intestine and or the large intestine, probably on the level of inflammatory bowel disease. So this is something that is imperative to look at. Now, you could have an acute infection like a parasite that might cause that too, but you have to correlate it to the behavior. A lot of kids will run and play, run back and forth and throw themselves on the couch or throw themselves on the floor. But if your child is doing this type of behavior, where they're leveraging themselves across a table or the arm of a chair or arm of a couch, and they do it pretty consistently in association with agitated behavior, irritable behavior, a lot of bloating and gas, this is more of an indication of a bowel problem. Because a lot of little kids don't have that upper body strength to leverage discomfort in their intestinal system. So they have to leverage their body over something solid to get that pressure relief. Don't assume self-injurious behavior is just because they're irritated or mad or something that they can't do. And that can come up in certain circumstances. Self-injurious behavior needs to be looked at as something completely abnormal. And my feeling is, first and foremost, looked at, or at least ruled out, as a biological problem. This particular scenario was of a child with severe inflammatory bowel disease who was injuring himself because of the pain that he was having. I have seen cases of self-injurious behavior occur because of Clostridia bacteria. That's why the organic acids test is so important to do. I've seen cases of self-injurious behavior not because of inflammatory bowel disease, but because of chronic inflammation in the stomach through gastritis. So it needs, the first place I look for, and I think that you need to think about with self-injurious behavior, is there something going on in the GI system? Is there something going on in the digestive system? Now, seizure disorders can also play a role in some kids. And to be honest, there are some kids that don't have gut problems per se or anything that's leading to us. Sometimes they'll headbang themselves under frustration or self-injurious themselves when they can't do something they want to do, or it's situationally involved. They want, I don't know, they want a cookie or something from the refrigerator that they can't have, and that's the way they acted out. That's a situational problem. This is more of a pathological, persistent type of a problem. They're doing it under situations where they're having extreme pain. So if we just went back and looked at this comorbid condition list, this list is pretty short. GI issues are huge, and these other issues follow suit, okay, the sleep problems, etc. But so much links back to the digestive system. It's got to be a first place, in my experience, that I look at in practice to make sure it's not a problem. And as I mentioned, that's just a partial list. Let me talk to you about a boy that I saw many years ago. Very, very severe in his presentation, and actually had a lot of self-injurious behavior, a lot of erratic behavior, and his situation was so severe that he had such severe injurious behavior that there was times that he would severely injure himself. Okay, this is an image of him putting his head through the wall. This is an image here of him putting his head through the wall and severely lacerating his scalp. At times, the self-abusive behavior was so extreme that the mom and parents would actually, this is a padded helmet, and would have to pad his hands from hitting himself. Seizure disorders chronic infections, all of these things were ruled out. Food sensitivities, I mean, they did everything, okay, to look for the cause. He was hospitalized, put on major suppressive medication to try to control these problems. Living in a padded room, okay? They'd have to pad the room in order to prevent him from hurting himself. And essentially, like a lot of families, unfortunately, tragically, trapped and emotionally on the edge, okay? Not even be able to leave the house because of the concern that he might injure himself so severely. What turned out was often these behaviors were preceded by this leveraging behavior. Okay, he would tend to leverage himself across and against furniture. So the question is this child in pain? Well, kind of drive this point home, he was scoped. Dr. Krigsman, Arthur Krigsman, is a pediatric gastroenterologist in Texas, also practices in New York City. And he's a specialist in GI assessment for special needs kids. And I've had a number of people seen him over the years. And so he scoped this child and found out he had severe inflammatory bowel disease. And in treating the inflammatory bowel disease, through specific treatment for inflammatory bowel disease, essentially Crohn's disease, he's had good, very good improvement overall. Now his case is very severe. So he's not a child that is, unfortunately, not going to be not autistic. And he's older, too, and that sometimes plays into it. But to me, that's not the point. Whether you're going to have a child who's can completely lose their diagnosis, which would be wonderful for all, but becoming more functional, becoming happier, becoming a more contributing member of the household. Not to the point where they're self-injuring themselves and endangering others. That's certainly no life. And that is the goal of, I think, any biomedical approach, is to try to prevent that from happening. The hope is that all kids could lose their diagnosis. The reality is that all can be helped, but not all will lose their diagnosis. There is no specific cure, so to speak, but there's many interventions that can be extremely helpful. What is it about the gut and the brain, right? We know that the large intestine, I mentioned this before, what's called the colon, is the area where a lot of fluid, a lot of water is reabsorbed into the body, and then essentially we compact the toxins that come from our body into the fecal matter and eventually excrete them. Well, what happens is when we reabsorb that water, it's taken back to the liver. And then the liver recirculates it and dumps it back into our bloodstream, and then it eventually gets refiltered again. So if we have chronic constipation and we've got chronic inflammation in the gut, many of the toxins that come from the bacteria and the yeast don't have anywhere to go. So they get reabsorbed back into the bloodstream and then recirculated. And those toxins, just like I mentioned before, that come from Clostridia and come from yeast, get recirculated and taken back up to the body where they can create chemical imbalances. So this is why the diet and working on gut function is so important as a foundational intervention. There's some researchers that looked even deeper into this. There was a researcher out of Harvard and individual out of the University of Warsaw in Poland. And what they found was that there's this bidirectional axis, this link between the gut and the what's called the microflora, the microbiome of the gut, and the brain. And it turns out that one of the routes that certain bacteria can take that can have an influence in the brain is directly through the nerve that feeds information back from the gut to the brain. It's called the vagus nerve. And what this is showing is that we can have bacteria and candida, yeast, that reside in the gut that release toxins that can get circulated through the bloodstream and then find their way throughout the body and cause imbalances. That's one way that can happen. But that there are other toxins that come from bacteria in the gut that can find their way directly into the brain, being moved there through these nerve pathways coming from the gut to the brain. And one of the areas that these toxins manifest in is in what's the part of the brain called the cerebellum. And the cerebellum is this part of our brain that's involved in receiving information from the external world and through our sensory system that helps us be oriented in space. Sort of helps kind of figure out, you know, where our left foot is, our right foot is, and are both feet solid on the ground. And this part of the brain becomes overwhelmed with these toxins, where it causes sensory imbalances that can then also lead to emotional imbalances because they affect a certain neurochemical in the brain called GABA. And GABA is this neurochemical that is involved in helping to regulate emotions and excess electrical activity. So the anxiety, the stress, those types of things can be exacerbated because of the presence of these bacteria and toxins coming from the digestive system. What about the fourth pillar? Something we're going to talk about later in the course. We'll do a whole module on methylation. The bottom line is this. It's really important, okay? Because what has been found is that likely there's nothing in, well, how do I phrase this? There's likely not too many things in autism or in any of our health, in anybody's situation, that isn't somehow influenced or affected in some way or another by methylation. And this methylation, this whole thing, methyl is a chemical group. It's a chemical group. It's a carbon and 3 hydrogen linked together. And the methylation process is just that one chemical, you know, you transfer one methyl group to another group and it alters the function of that specific chemical. That's what's happening. But it has this global effect on brain function, on awareness, on eye contact, on immune issues, on neurochemical. It even helps with detoxification. And I never want to oversell a therapy, and I never want people to assume that one therapy is specific for just one thing, because there's an interrelationship of all of these systems in the body. And the methylation system will not only influence other systems in the body, but other things that are happening to us, food sensitivity, gut infections, toxins, can also adversely affect the methylation system. And so we're just going to focus primarily here in this course on an overview of the methylation system, particularly with regards to something called methyl B12. And methyl B12 is really important as a nutrient because it is primarily responsible for making the methylation system move. We need to be moving throughout these different steps in order to keep this biochemical wheel spinning in the proper direction so that it can have an influence on language, on cognitive function, on socialization, etc. And so one of the primary tools to do that with is methyl B12. Now you have access to this book in this course. So it's actually in the website for this course. You have a complimentary copy of my methyl B12 book as well as my Autism Road to Recovery book. And this book is a guidebook. It actually goes through step by step on how to do and implement methyl B12 therapy, specifically the methyl B12 injections, but it also talks about supplementation and nasal spray, etc. So we're going to get into that later in the course. The injections are a very useful way of implementing this treatment. and I would say is really the gold standard compared to other forms of methyl B12, but I don't want to make it sound like other forms of methyl B12 aren't helpful, because the reality is not everybody has access to the injections, and some kids do well with other forms of methyl B12. It's just the route of delivery and the concentration at which it's given. The one thing I want you to understand too is when we're talking about methyl B12 therapy, we're not talking about a deficiency of that specific vitamin. So you can go out and do a blood test of B12 on your child, and it might actually come back normal. But they still could respond quite profoundly to methyl B12 because it's not about a deficiency of B12, it's about a biochemical dependency, meaning that methylation sequence, okay, let me backtrack here. The part of the methylation cycle right here, going from this homocysteine to methionine, is not working right. And it's utilizing the methyl B12 that gets that wheel spinning. It gets it moving. Also, there's different types of B12. We have something called hydroxy B12, cyano B12, adenosyl B12, and then methyl B12. Well, it turns out that methyl B12, at least from what's known, has one specific function, and that is to switch on that homocysteine to methionine conversion. And that has this global effect on brain and nervous system function. So more to come on that later. There are other forms of methyl B12. Methylmate is a liquid form of methyl B12. And what's cool about methylmate is it can actually be made into a nasal spray. The nasal spray is a nice option for some kids, usually older kids, teenagers. And it's something that you can do on your own. It doesn't require a prescription. This Revitapop, I actually like the Revitapop. It's a lollipop of methyl B12. And it actually works pretty good. Little kids don't get the whole concept sometimes of putting a lollipop in their mouth and just sucking on it, but older kids do. And what they figure in how the Revitapop works is that the methyl B12 actually gets absorbed from the oral mucosa, and it can have a pretty quick onset. And then there's different supplements of methylfolate, which are complementary to methyl B12. I want to try and emphasize this impulse of just running out and just sort of randomly trying a bunch of different supplements. There needs to be really, I believe, a methodical approach to this. And this is why I'm going to teach this course in this way for a new parent or a parent that's just kind of getting into this, or maybe has been to it but never really went real deep, is to have a good, solid, foundational approach in what you're going to do, starting with one thing, moving to the next, etc. One thing I do want to emphasize, though, too, is when it comes to biomedical intervention, there's not a test for everything. You can't run a test for every single thing. Even when it comes to the methylation cycle, there are very sophisticated lab tests that look at DNA, enzymes, chemicals within the whole methylation cycle. And they're indicators of where there may or may not be an imbalance or an issue. But sometimes the reality is that the real test of whether something is going to work for your child or not is to try it. And we're not talking anything, in my experience, from all my years of practice, anything that's toxic or dangerous. Now, your child is unique to yourself, and certainly you want to be, working with, a health practitioner if you can. But, when you're trying something like vitamin D, or you're trying a few things, multivitamin, for example, or trying the gluten casein-free diet, these typically are not dangerous interventions. And sometimes, again, a test is not always conclusive for everything. So it does sometimes come down to trying a supplement to see what kind of effect you get. And that therein lies the test. Okay, let me wrap up here on just learning, and again, we're going to talk about this through other lectures within the course. But this is troubleshooting problems, understanding that certain behaviors may not always be related to a medical problem. It's easy to go through a course like this and just focus in and say, well, everything's a biomedical problem. It's all of it's got to be a supplement issue, or it's all got to be related to yeast or something else. And this was a boy that I saw many years ago. He's actually a little bit older, teenager when he came in. Severe autistic at the age of 2.5. Like a lot of kids, a lot of anxiety, sensory-seeking behavior, aggressive behavior. The main physical problem that he had was severe constipation. The main reason for the consult was aggressive behavior in what the parent described as destructive tantrums. And they had implemented a lot of things for his constipation, a lot of Miralax and suppositories. So I knew that talking in this situation, we had a kid who was very, very constipated. So I implemented this particular approach. And that was to try to just evacuate his bowels as best we could, to see if that helped resolve some of his behavioral challenges. So we did some enemas, we did some Miralax, and eventually switched him over to some ground flaxseed, some magnesium for long-term maintenance. What was most impressive was the amount of stool that he released in a very short period of time. This was one bowel movement of many. This is a police flashlight. This is one of these huge flashlights. This was a huge piece of poop. And again, this was just one. Look how hard it is. This boy was severely constipated. So all of the food that he would eat and the toxins, okay, couldn't go anywhere. It just built up in the bowel. Yeast and bacterial toxins that might be there could just become backed up as well, recirculating throughout the body, causing problems. But also, think about being this constipated. He was uncomfortable. A lot of pressure in the lower bowel. Just not feeling well. And so a lot of his aggressive outbursts were because of the fact that he was in pain and discomfort. And the mother reported that within days of doing this bowel evacuation, his aggressive behavior dropped by 75%. So fantastic, we were on a roll. And so mom was quite happy, sleeping better, less agitated. But the negative behavior didn't disappear completely. So it wasn't all related to a physical problem. So I started investigating a little bit deeper. And I would ask about when he would become aggressive. And it turns out that he would only, through my interviewing of the parent, would only hit his mom, his sister, his aunt, and in the past, his grandmother. He would not hit any males in his life. So he wouldn't hit his brother, father, or his grandfather. He would not touch a male in his life, but he would hit the women in his life. And so the parents' concern was there any treatment for this? You know, was there any supplement or medication that might help? And I said, well, in my experience, there's not, because he's had a learned behavior, unfortunately, that it's okay to hit women. And I see that as a problem. He's 14 years old, and he's learned this behavior. He's, you know, severely autistic. He needs to learn eventually that this is not appropriate, and that somehow this has been allowed. By, you know, I wasn't placing blame, but that was just a reality. And I found it interesting that mom had emphasized that in the past he would hit grandma. And I asked, well, why doesn't he hit grandma anymore? And it turned out that grandma got sick of being hit, and one day she slapped him back and told him not to hit her again. And not that anyone was advocating that kind of, a response, but it worked. He never, after that, hit his grandmother. And what it proved to me at that time was, still does, I still have cases like this, that, kids on the spectrum are incredibly bright, and they can learn, and they can know what's right and wrong, and they need to have boundaries for these types of behaviors. And I'm by no means an expert in behavioral therapy, but when it comes to physical violence, these things need to be resolved. And there have been other cases in my practice where it wasn't a biomedical problem. It wasn't a food sensitivity. It wasn't a gut problem. It's the fact that you had an individual who learned that it was okay to be aggressive and that it was tolerated. And it's not, in my opinion, appropriate. And, they need to understand that it's not appropriate. It's not an appropriate way to respond. But if we had not done our initial work, and through my years of experience in understanding it, we could have just assumed it was all related to a non-biomedical problem. Turned out that 75% of his aggression disappeared because he was severely, severely constipated. So it certainly also showed the fact that an underlying problem of constipation and the toxicity that comes about from it, you bet can contribute. But again, in this particular scenario, the family needs to look deeper and look at ways of trying to resolve this behavioral problem, which eventually they did. Okay. So, Module 2. We're going to go into a little more information about nutritional supplements, how, timing of supplements, helpful hints on implementing supplements, and get more into the aspect of supplement intervention as a Pillar 2 approach. And then from there, we're going to go into, in Module 3, the organic acid testing. Make sure if you have questions to, post me on the forum to go over any of these topics. And then, of course, look at the documents as well. If you have questions about those, let me know through the forum too. So, appreciate everybody's attention. I want to point out one more thing. We do have a website called Lab Tests Plus. LabTestPlus.com is a website that does house access to certain lab tests, many from Great Plains Lab and some other labs that offer up different integrative medicine testing. So you could do the organic acids test, for example, through Lab Test Plus, and each lab that comes back to us has a specialized written interpretation for the markers on that test that are most relevant, along with what are called action step suggestions. So, different things that can be tried, etc., based on the information of what the objective data of that lab test shows. So if you're interested, you can go to labtestplus.com and look at the menu list of the labs that are offered. Thank you so much, and I'll see you in Module 2. Take care.